Hi, my name's Dr. Elizabeth Ortiz. I'm a board-certified rheumatologist and founder of Connected Rheumatology. I've had the privilege to care for thousands of patients as they navigate their rheumatic diseases, and I've had a front row seat as they face the daily challenges of their conditions. Over all these years, what I have found to be fundamental to a successful care plan is a strong patient-doctor relationship. And strengthening that relationship for others is become my North Star in everything I do. That's why I'm so excited to be sitting here today with Cheryl to learn from you and to share some tips on how to build a strong patient-doctor relationship. Cheryl, it's great to be here with you today, and I'd love to hear more about your story.
Thank you so much. So, I have had rheumatoid arthritis for about half of my life. I was diagnosed in college with adult rheumatoid arthritis, even though I still felt like a kid at the time. And I then became an occupational therapist and formed my own patient education organization called Arthritis Life, where I really try to help people learn how to not just survive, but really thrive with these conditions, which is something I know you're really passionate about as well. And part of that is learning how to partner with your doctor and learning how to make difficult decisions. And so I'm really excited to be here today to just discuss a little bit more how patients and doctors can work better together and feel better about their appointments.
Absolutely. No, I think we're going to have a lot to say today. So before we get started, or to get us started, I have some stats from a recent survey conducted by AbbVie that I think really highlights what we're here to discuss. And so I want to go over them and then we can dive in. So this survey asked over 400 people in the US living with rheumatic diseases, including things like rheumatoid arthritis, psoriatic arthritis, and axial spondyloarthritis. These people were between the ages of 18 and 65, and they were asked questions to better understand communication dynamics between them and their rheumatologist. So what they found was that more than half of the people surveyed reported experiencing at least one negative emotion after leaving their rheumatologist appointment. Most commonly, they reported feeling anxious or overwhelmed. And over half of patients wished for more time to discuss their needs during their appointments. So, Cheryl, my first question to you, after hearing this, does any of this surprise you?
It's not surprising at all. In fact, 50% of people saying they wish they had more time seems low to me. It feels more like in the majority, vast majority of people wish that they had more time to discuss these complex conditions. To speak with from my own story, when I was diagnosed, I always say it felt like whiplash because I had spent 2 years before my diagnosis begging doctors to take me seriously and being told, oh, you're not sick, you're just anxious, you need to just stop stressing out. And then all of a sudden, in the blink of an eye, they're like, oh, you actually are sick. And now we have this fire hose of information and all these really big decisions you have to make rapidly. And I didn't have any time to process, like, wait, this is a huge deal. I have to wrap my head around this now. And it's just, unfortunately, there's sometimes we just don't have endless time to ask our doctors all the questions that we may have. And to speak to the, emotional side of things, unfortunately, it's not surprising to me to hear that, many patients feel anxious and overwhelmed after their appointments. Um, these are really profound conditions to live with and difficult to feel like you have adequate support around you. But I'm curious from your perspective, were you surprised at all about these findings?
Well, I have to admit that seeing those results, I was certainly disappointed, but I've got to say I'm not really that surprised. As a rheumatologist, and I will speak for most rheumatologists, we go into this field wanting to help patients in the face of these complex conditions. And we all strive for optimal care. And optimal care has to include empathy and making room for all the emotions, like you described, that happen when you get a diagnosis of an autoimmune condition. The reason I'm not surprised, however, is I've been on the receiving end of thousands of these types of conversations. And I know when an appointment has ended and yet there's still more to say. And I also can appreciate how overwhelming a new diagnosis and all the things that we have to discuss are. In fact, I've had to kind of change my own clinic flow to allow for that time because it is so overwhelming.
Yeah, one of the things that came up for me a lot in the beginning was the lack of black and white answers. A lot of times, rheumatology seems to live in a lot of gray areas. And so I felt personally like there was so much uncertainty, like this might work, this might not work. And for me, that's where the rheumatologist input was so helpful in providing that clarity. So I felt like I was drawn a little bit out of that messy gray area into something that made a little bit more, a little closer to black and white. It's not going to be all the way black and white, but they can provide just a little bit of clarity to get you out of that overwhelm and that gray zone.
Yeah, no, I think that's where rheumatology as a field really shines because everything we do is in the gray area. And, what a really strong patient doctor relationship, if you have that foundation, you can then maneuver that gray area together and kind of find the scaffolding that you're going to build a care plan around so that the person ends up feeling better and not just feeling better, but feeling confident in that plan.
Yeah, on that note, I would love to hear from your perspective. What are some of the things that you do in your appointments to make the patient feel more comfortable addressing the emotional side of the experience?
Yeah, well, I've had to learn how to make room for all those emotions in the short visits that we have. And so, what I do is I like to have dedicated time both at the beginning and the end of an appointment where I just let the patient talk and I let them kind of express whatever they have on their mind. And, I certainly walk into every appointment with goals and an agenda, but I don't want to lose sight of the fact that I'm not the only person in the room and that this other person needs to and should contribute just as much to the appointment and to the plan that we're going to put together. And so I need to have time for that. What have you found that your rheumatologist does?
Yeah, it sounds really similar to you. I mean, part of it is just like you mentioned, making space, that emotional affect, having that, caring outlook, that warmth. And another thing that she's done that I find really helpful is she asks me about how my life overall is going, not just my joints. She just seems to innately understand the big picture and says, are you able to, when I had a baby, how is it going with your baby? Are you able to work? It makes me feel like she's looking at me like a whole person, not just like a joint or a series of joints. And so that has gone so far in making me feel connected to her and trusting her when we have those more minutia conversations later down the line about care choices.
That's amazing. I'm so happy to hear that you've found a doctor that you feel comfortable with and that you're on the same team. I've always found in my practice that that's always the best experiences I've had is when me and a patient are on the same team working towards the same goal. And I totally hear you when you talk about the overwhelm that you feel with a new diagnosis and all the decisions you have to make. I've often found that the second appointment you have with your rheumatologist is actually much more important than the first one because that's usually the appointment where you're going to go over test results and you're going to talk about what you're going to do next. And I think it's crazy that in a lot of practices, typically we get 30 to 60 minutes for that first appointment, and then after that, only 10 to 15 minutes. And so what I found was I needed to kind of rearrange my schedule to allow for that second appointment to have more time specifically for what you were describing to kind of handle that overwhelm and talk through what we need to do next. What I have found is that it's a balance between helping someone manage that overwhelm, but also pushing forward with the care plan. Oftentimes, it can take patients years to finally arrive at a diagnosis, and I don't want to spend more time than necessary before starting a care plan. So, how would you recommend people go about that balancing act of managing the overwhelm with the urgency to get started on a plan?
Yeah, reflecting back, I actually can remember some of those first appointments I had with my rheumatologist. And I think something that she did that really helped is first, she validated that I understand this is overwhelming. You're not alone. Everyone I talk to experiences this overwhelm. And that's a beautiful thing to realize that, oh, it's not me. And so that validation is step one. The second thing she did is that she explained that there were so many patients she's seen over the years just like me, in as much pain, as much fatigue, as much overwhelm as I was in. She's seen them become completely successful on a care plan, and that was possible for me too. So she gave me that hope, and that kind of nudged me to feel comfortable discussing the care plan in more detail.
That's great. I love to hear that. So I have some more stats. So, that same AbbVie survey found that over 25% of patients don't tell their rheumatologist everything out of fear of being seen as complaining. And nearly half of patients describe their pain differently to their family and friends than their rheumatologist. Have you noticed yourself doing this? And have you ever felt like you couldn't speak up because your concerns were either dismissed or not prioritized by your rheumatologist?
That's a really good question. I will admit that after over 20 years living with rheumatoid arthritis, I still struggle to put into words, even for myself, what pain feels like. I feel like pain, it's kind of like love. You know it when you feel it, but how do you define it? How do you put it into words? So I think it's a fundamentally very challenging endeavor. A simple scale of 1 to 10 is so woefully inadequate, it feels almost meaningless. Anyway, that's my soapbox on that. But so it's so challenging to put words to something as complex as pain. With rheumatoid arthritis, I have stiffness, I have soreness, I have a dull ache, I might have a decreased range of motion, I might even have some hot tenderness. Those are all such different feelings. One thing that did help me is to think about, I'm a very visual learner, so I thought about analogies. Like my doctor actually remembered this, that I said to her when I first got diagnosed, I feel like there's hot glue in my joints. So thinking about something, being able to anchor it in something really specific, or for fatigue, I feel like I'm having to walk through mud when I'm just walking 5 feet from my bed to the toilet. It's really painting a vivid picture for them helps. Back to your question though about describing it differently to friends and family versus your doctor. So much of that depends on the specific context of whether you feel supported by your friends and family. I've been really lucky that I've had really supportive friends and family, but I also run support groups for people with rheumatoid arthritis. And unfortunately, I've heard so many difficult stories from people who say, well, yeah, my friends don't believe me. My family doesn't believe me. They think it's just arthritis and that I'm just complaining. So if you hear that over and over again, you can feel really defeated and not even want to talk about it in the doctor's appointment. Another thing that I found a bit paradoxically comforting is to recognize that I have a zone of control and sometimes I can do everything right. And my doctor has validated this. I could do everything right. And then sometimes I can still have pain or still have fatigue. And that's not a personal failure. It's just the nature of the condition. Having that conversation with my doctor really helped me alleviate this pressure to like be the good patient and try to have pressure myself into saying that things are better than they really are, because I just want to have that positive hero's journey. So, remembering that there are things I can do the best I can with the choices I make in my life, but sometimes even if I do everything right, it won't all go right, but I can still focus on, living a good life with any remaining symptoms. That's a helpful thing for me. So, I'm curious for you, Dr. Ortiz, like what are some of the things you do when you can tell your patients are maybe really overwhelmed or maybe reluctant even to open up to you about their pain?
I mean, I really appreciate hearing your side of things. And I especially that what was it, hot glue in the joints?
Yes.
That's very powerful visual. It reminded me of what I oftentimes hear patients will describe, just kind of like the fire inside or feeling like they got hit by a bus first thing in the morning. That kind of descriptor, which doesn't come naturally to everyone, but it really does help paint a picture because you're absolutely right. I agree with you that the pain scale is lacking in its specificity and its ability to give us information that we can do something about, right? That's what we want to do in clinic is help. And sometimes the pain score doesn't really tell the whole picture. As far as what I like to do, I really like your tactic of the zone of control. I think that can actually be applied to a lot of areas in life, including in the clinic, because you're absolutely right. You can only do your best to clearly describe and explain what your experience is, but doctors are humans too, and there can be any number of influences to their reaction to that maybe have nothing to do with you. And so keeping that in mind, I think, is always important. Um, but like you were describing how with your visual mind kind of describe the pain, I think finding other ways to describe how the pain is impacting your life is really instructive and demonstrative for the doctors to hear. Because you might put, say, that you're 6 out of 10 pain, and I don't quite know what that means for you because your 6 out of 10 is going to be different than somebody else's 6 out of 10. But then you describe, well, I can't pick up my baby. I can't cook dinner for my family. Okay, now we have a much better understanding of how the pain is impacting your life. And we have a benchmark that we can then go back to as we change care plans or kind of work through things. Like we can ask, well, how can you carry your baby now? Can you cook dinner now? It gives us all a benchmark.
Yeah, no, I love that.
So I do want to highlight that what we're talking about talking about this conversation about pain really is best when it sits on top a strong foundation of shared goals. I think that this is really the foundation of having a successful relationship with your doctor, but also having a successful care plan. And the reason it's so important is because what might be important to me as the doctor might not be the same thing as the patient. And so it might be my goal to reach a certain threshold of some test result, but it might be the patient's goal to be able to dance at their daughter's wedding. And if we don't have an understanding between the two of us of those two goals, then when it comes time to talk about next steps, we might find ourselves at odds because we're actually not going we're not going in the same direction. And so I just want to highlight that you actually need that first, and then you can have these conversations about pain because, again, how we think and talk about pain really depends on, well, what direction are we going?
I really love what you said about personal goals and really specifying it to your life. I honestly think that's one of the most powerful things patients can do is before your appointment, think about, if someone was videotaping your life, what would they see? What would they see you struggling with? And in occupational therapy, I'm wearing two hats here as an occupational therapist and a patient with arthritis. No goal and no activity is too small. If you're telling I tell patients, if you struggle to put your hair in a hair tie in the morning, if you struggle to scrub your scalp with shampoo, if you struggle, even just going through your morning routine, frankly, can be a goal of mine of potential specific goals. And it has a dual function of it paints this vivid picture for your doctor on how you're functioning. And it also helps you be on the same page about what are you going towards? I want to be able to wash my hair without pain. Another thing that this makes me think about as an occupational therapist is that the doctor and the patient relationship is that foundation to the care plan. But there also, in addition, are all these other allied health professionals that sometimes get forgotten in rheumatology. People like physical therapists that can help you with an exercise plan, occupational therapists that can help you really execute a plan for those daily activities. We have hour-long sessions with patients where we can go through all their routines, give them adaptations, life hacks. We have registered dietitians that can bring you that expert guidance for nutrition. Even if you're the best rheumatologist in the world, you don't have all the time to do all of that in your appointments. So why not have a team approach? I really advocate for that. And it's, as the patient, you feel a little bit less alone and overwhelmed when you know that there's a whole team behind you.
I could not agree more. I am a big proponent of when you get a diagnosis like rheumatoid arthritis, the psoriatic arthritis, you have to find your team. The rheumatologist is obviously going to be a big part of that team, but really shouldn't be the only member of that team. You need lots of different people with lots of different expertise. I tend to think of all other healthcare professionals, including occupational therapists, as specialists. They have a specific specialty and a point of view into how they can help with your particular condition. And they have a point of view that rheumatologists don't have. I am not a dietitian. I am not a physical or occupational therapist. And I think that we do ourselves a disservice if we don't include those members on our team. So I'm going back to the appointment. I know we've touched on how quick these appointments can be. I'm interested to hear from you, Cheryl. What have you learned and how do you prioritize what you want to talk about in these visits?
The thing I start with is understanding how long the appointment is. It sounds so simple, but you can't triage your questions or you can't prioritize what questions you want to ask your doctor without knowing how much time you might have. So, simply when you make the appointment, ask, is this a 20-minute appointment? Is this a 30-minute appointment? That will help you scale down what you want to ask your doctor. Second thing is definitely preparation. A little bit of preparation goes a long way. Before each one of my appointments with my rheumatologist, I write down, in my case, it's on the Notes app on my phone. It might be in your own symptom tracker or journal. I just write down what's going well, what's not, and what are my biggest questions for my doctor. I then also utilize the patient portal and decide, are some of these questions something that I could simply ask on the portal? Maybe she can give me a quick answer instead of having to use that precious one on one time. So for me, it's a matter of preparing ahead of time, deciding ahead of time what my priorities are so I don't feel like that deer in the headlights when my doctor says, "Oh, how are things going?" I know I've already spent some time reflecting on that. The last little thing, and because then I want to hear your opinion, is, to the extent that it's helpful for you. Symptom tracking can be something that can be really powerful to bring to the appointment. You might tell your doctor, this is how, for example, how many minutes of morning stiffness I have on average. 5 of the last 7 days, I had morning stiffness lasting 30 minutes. Those are some really concrete things that can help you and your doctor understand whether your care plan is working or not. And again, I don't know about you, anyone listening, but I sometimes just forget in the off the top of my head. So I like to spend time before the appointment thinking, okay, yeah, how long was it over the last few weeks? So I'm
Yeah.
curious from your point of view, though. Yeah, what are some of the things that you do?
Well, I mean, I'd love to hear how you come prepared, that you've thought about it before walking into the appointment. I love it whenever I walk in and I can tell a patient is just as prepared for the visit as I am. And I oftentimes will see patients take out their notebook and apologize for having the notes. I'm like, don't apologize. Like, I'm happy that you have these notes. It honestly makes my job so much easier. I would much rather sit there with someone who, is ready and says this, as opposed to me having to like pull it from them. So I am a big, big fan. I love how you utilize the patient portal. I'm a big fan of that as well. I also will recommend that patients use that as a tool to communicate with the doctor about what their agenda is. Every clinic uses the patient portal a little differently, but you can send your agenda or, hey, doc, these are the things I want to talk about in our visit ahead of time. Nothing needs to be done right now, but at least that doctor knows what they want to discuss walking in the room, and it can make the time so much more efficient. Like I said, every clinic works their portal a little differently, and so it can take a few rounds of this before you really get into the groove of it, but I highly recommend trying that out.
What you were saying really reminds me that when my doctor and I are working together as a team, it almost feels like we're a detective team, looking over some of these symptoms I've tracked, trying to figure out what's going on. And like we mentioned earlier, sometimes it's a gray area, but you can start seeing patterns over time when you have these specific goals and maybe you have some hypotheses about how you're going to be able to achieve them. And I think that's really in my experience, over now I'm kind of a professional patient over 20 years. It feels so much better to feel like a true partnership, like we're both working on the same thing versus like you tell me what to do or I tell you what I don't want to do. It's just a lot easier.
Yeah, absolutely. I mean, like we talked about before, rheumatology is full of gray area, and you go further together, right? And so working together towards the same goal and really trying to tease apart what is what's going to help this, what's going to help that, what should be the next best step. It's so much easier for me as the doctor to have a partner doing that. I think oftentimes we defer to the doctor as the expert. But what I always like to remind patients is I may have a little more medical knowledge and experience than the person in the room with me, but they have a lot more experience living their life and being them. And we actually need both of those expertise to be able to create a successful care plan and a care plan that's going to work because the person is confident in it.
I was thinking about how some of the most challenging conversations, but important conversations I've had with my rheumatologist are, what is realistic for me right now? As the patient, I know what I feel like every day, but I may not know what clinically, in your opinion, is possible for me to feel. Is it possible for me to feel much better than I am? And am I settling too soon for a care plan that's not really adequate? And so I think there's these three entities in a way. There's the doctor, the things only the doctor can do, things like, writing a prescription, or things like um, determining how long, starting and stopping the appointment, and then there's writing a referral. There's things only I can do, and things I'm in charge of, which is what am I going to put in my body? What am I going to do with my body, and what do I value? What's important to me? And then there's this third entity that's created throughout the relationship, which is the partnership. And we're having to kind of continuously feed that partnership through our conversations, and it becomes this joint movement, so to speak. I would say, like, we jointly have to decide, okay, we have a back and forth conversation, and you say, okay, this is what I think is possible for you, given my medical expertise. And here's a few different ways that you can get there. Which one sounds better to you? And I can have that back and forth. Does that sound similar to your experience?
I completely agree. I've always thought that we as the doctors, we make the best decisions we can with the information that we have available. And I think what's not appreciated is how much of that information actually comes from the patient. Everyone assumes lab tests or x-rays or MRIs, like that's what is going to tell my story, but actually no, it's the patient. And so being a part of that partnership, speaking up and contributing fuels the success of the outcome for that patient.
I love that. And I think the only other thing I wanted to share with you or reflect on, I'm curious if your patients have felt this way too. In the past, when I have found a care plan that's working really well, and then sometimes slowly over time it stops working as well, and I'm a little bit in denial sometimes, and I feel very attached to that initial care plan, and I don't want to change it because I'm afraid of the unknown. Is that something your patients ever struggle with, and how do you help them?
Oh, of course. I mean, I struggle with
Yeah.
that. Like, I will walk in a room and I know someone has been doing well and now they're not. I'm not happy about that. Like, I will look at all the data and listen to the patient and will be equally disappointed. But it is my job to have plan B, C, D, I feel like it's the
Yeah.
alphabet. I would actually also, just to piggyback on that, recommend that when you're starting out and you're developing your first care plan, to ask up front, what will we do if this doesn't work? Because most doctors will know what they're going to do. They're in the back of their head, they know what plan B, C, and D are. They might not necessarily volunteer that up front. And, kind of talking about what we were talking about before about the overwhelm and all the information, I don't, I am cognizant of that and careful not to just like throw too much. But I think it can be helpful to know, even if you don't even know the details, that there is a plan B
Yes. Yeah.
and that sometimes you have to implement plan B. And so if it's not brought up by the doctor, I think it's always a good question to ask. Just to know that they're thinking ahead, let them think ahead. You can focus on the now, but know that that piece is taken care of if you have to cross that bridge.
Yeah, 100%. Knowing that there's another option really helps for me at least decrease my anxiety over time.
I really think it's interesting how you made the comment that you would get attached to your care plan. It's actually a concept I'd never really considered before. And I'm wondering if you think that that attachment you have to a care plan actually prevents you from acknowledging when you're not maybe doing your best because you're so attached to this particular plan and any other possible plan is scary.
Yeah, I think it comes down to that fundamental fear of the unknown. Just like maybe patients have that in their very first appointment when they get diagnosed, they kind of confront that fear of the unknown in different ways throughout their journey over time. Even if my care plan isn't perfect, I'm sometimes like, "Oh, I don't know if I want to make that jump to a new plan because I'm used to this. At least it's something I already know." And I think on a rational level, to give me and other patients some credit, there it if a care plan is working kind of okay, it's not horrible. It's not, but it's not the best ever. There is a legitimate, I think, fear that the next plan could be worse. But I think that that's where the doctor's expertise comes into play, because you can say, based on this wealth of evidence, your training, your understanding of what is happening in my body on a cellular level and how different care plans can affect that positively, you can say you don't have to settle for good enough. There is a better plan out there for you, and let's give it a try.
I can definitely appreciate that, and I can see now. I'm kind of reflecting back on hundreds of conversations I've had with patients, and their response to this conversation, like we're talking about, like, well, there's, you know, some room for improvement for their disease state. I think that there's some more control we can get. We need to shift the plan a certain way. And I have found that that actually is a hurdle for people, even being willing to acknowledge that they might not be doing as well as they want, because they're certainly doing better than they were before any plan. And I think that I've had to do a lot of education with patients about that. It's like, I'm obviously thrilled that you're doing better, but better wasn't the goal. That we want remission, we want low disease activity, as we call it. Now, hearing your perspective, it's really kind of opened up my eyes as like what's going on, and like that attachment that you can have after the journey that led you to that point.
Yeah, and I think sometimes there are just simply knowledge gaps that the provider can fill in that appointment. Say, don't worry, this is not the only one. I often say to newly diagnosed patients, that's like where my heart is. I love helping newly diagnosed patients. I say, like this is a learned skill. Living with this is something you can learn. And if you're feeling like you don't feel confident right now, it's just because you haven't learned it yet. No one's good at something when they first start it, unless they're like prodigy. But you have to learn. It takes time, and it's hard to be patient. But you're not alone, and you can adjust to this. You can do hard things, and there are many people before you who've done this. You're not alone. So those are all things I like to tell people to help them feel like they can wrap their head around this.
Yeah, totally. Well, Cheryl, it's been great sitting down and chatting with you. Our time, however, is coming to an end.